Good afternoon, everyone, and welcome to today's Circle seminar, which we're very pleased to have Dr Bephyer Parey speaking to us from the University of West Indies. She's calling us from Trinidad and within Trinidad and Tobago, and it's a great pleasure to have her contribute her thinking to our seminar series. Bephyer has a PhD in social policy, which was awarded in 2019, and I first met her at, I think it was a conference in Copenhagen, probably the Transforming Care Conference, I think in 2019, and I've been struck by her incredibly interesting work and the innovative work that she's been doing in her own country, but also with a view to understanding issues around disability care and well-being around the world. So it's really exciting to have her available to talk to us today. Without further ado, I think I'm going to invite Bephyer to talk about using SEND's capability approach and mixed methods to assess well-being, the case of working age persons with disabilities in Trinidad. So over to you.
Thank you, and I'm just going to say greetings, everyone, because I know if I choose a timing in terms of good morning or good evening, I'm going to miss out a person. So greetings, everyone. And thank you again, Sue, for the opportunity to present on this important topic, the use of SEND's capability approach and mixed methods to assess well-being. And as mentioned before, I am presenting the case of working age persons with disabilities in Trinidad. So I'll start off by talking about the relationship between disability and poverty. So these two topics are related issues. There is evidence that persons with disabilities are among the poorest in society and are at risk of remaining poor. The literature also indicates that a higher proportion of persons with disabilities live in poverty as compared to persons without disabilities. And there is also evidence that persons with disabilities experience multiple deprivations. That means they're deprived in more than one well-being indicators. And all of this indicates that there is a need to assess well-being among persons with disabilities. And this is important because a couple of the Sustainable Development Goals do promote poverty eradication as well as well-being for all ages. In terms of disability and poverty and how they are conceptualized, they're both conceptualized in different ways. Initial conceptualizations would have linked the issue of disability and poverty to the individual, meaning if a person was disabled or poor, the issue would have been related to something within the individual, but current conceptualizations of both of them do recognize social restrictions. So a person who is poor or a person who is disabled, they're essentially unable to participate in society on an equal opportunity basis because of the limitations of social structures in society. All in all, what these pieces of information say is that when we're assessing well-being among persons with disabilities, we do need to consider a multidimensional approach, as well as an approach that acknowledges the role of social structures. And that's where SEND's capability approach comes in. So SEND's capability approach has emerged as a valuable framework for evaluating poverty. For many reasons. It is a multidimensional approach, and with the capability approach, social arrangements are evaluated in accordance to the degree of freedom people have to achieve various functionings, and functionings are things that people do or be. And so there is explicit acknowledgement of the role of social structures within the capability approach. And some scholars have also written about the theoretical similarities of the capability approach with the social model of disability. So all in all, there is justification for using SEND's capability approach for poverty evaluations. Another important feature, actually a couple of features that are important for in the context of using SEND's capability approach, is the acknowledgement of diversity and choice. So the role of resources, structural factors, choice, and impairment are all acknowledged as influencers of well-being outcomes. So with the capability approach, disability and poverty are described as a deprivation of our functionings or capabilities. I already mentioned that functionings are things that people do or be. And just to give some examples, this would include things like being sufficiently nourished, being adequately sheltered, and so forth. And capabilities are essentially combinations of different functionings. Within SAN's capability approach, there are 4 different concepts of poverty assessments: well-being achievement, well-being freedom, agency achievement, and agency freedom. And these concepts are distinguished by 2 things. The first being the achievement of well-being goals versus the pursuit of agency goals, which might actually extend beyond well-being goals. And the second distinction is between achievement and the freedom to achieve, which are 2 different things. And in the work that I'm presenting here today, the concept of well-being achievement was applied, and we'll talk more about the analytical framework as we go along. So there have been a number of poverty assessments done using SAN's capability approach, and there is emerging literature on poverty using SAN's capability approach for developing countries, but there's still a lack of those assessments for the Caribbean. So there is a need to use SAN's capability approach in the context of the Caribbean. The paper I'm presenting on is the first for Trinidad. And I just want to talk about Trinidad a bit. And just to pause, Sue would have already mentioned that it's Trinidad and Tobago. So Trinidad is one of the islands in a twin island nation. And these islands are located off the coast of Venezuela, just to give some geographical context. So Trinidad is signatory to a number of international agendas, and one of them being the United Nations Convention on the Rights of Persons with Disabilities. There is a national policy which speaks to the inclusion and full participation of persons with disabilities in society. So one would expect that, things are in place for persons with disabilities to live well, but actually such is not the case. So there is a need to evaluate well-being among persons with disabilities in Trinidad. And as I mentioned before, I'm presenting the case of working age persons with disabilities. And just to give some definitions, so a working age person is someone over the age of 18 and below the age of 65. And disability here is defined as one or a combination of long-term mental, intellectual, physical, or sensory impairment. With applying SAN's capability approach, the first thing that needs to happen is the identification of functionings. We need a list of functionings. And SAN himself said that this list of functionings should include items that the persons for whom the evaluation is being done for find value in, or things that they find important. So this is why a participatory exercise is recommended. The other thing to note is that persons with disabilities is not a homogeneous group. They have been presented in the past in the literature as a homogeneous group, but they are not. So there is a need to consider as well the different disability types. And I already mentioned that consideration will be given to mental, physical, intellectual, and sensory impairments. So essentially, after finding the list of functionings, and I did use a participatory exercise here, we're using the information to build an instrument. And the purpose of this instrument is to measure well-being, or which essentially translates into measuring where the deprivations occur for the group of interest. And this design, where qualitative information is collected and then used to build an instrument to collect quantitative information, is something that existed in the literature. And it's the same one that I used for the study. The only difference would be the addition of an extra qualitative strand. And the purpose of this strand was to identify the reasons for the deprivations. So all in all, I'm using a mixed methods, clearly by the title of the presentation, and I'm going to talk more about it in a bit. But for now, I just want to go through the research questions I was interested in answering. So the first one is, what are the functionings of importance? How do the findings from individual interviews help to inform well-being measurement? I was also interested in answering the question, to what extent is well-being achieved among working age persons with disabilities in Trinidad? And then to find out what factors hinder well-being. And then lastly, how do the findings from the last two strands jointly explain well-being? So number 2 and number 3 are mixed methods questions. And when I speak about the mixed methods research design, I think they'll become a little more clearer. For now, I just want to talk about the paradigm stance that I adopted, which is essentially the paradigm stance I adopt for all research. It is critical theory. So critical theory is a way to instigate social change by providing knowledge of the forces of social inequality that can in turn inform political action aimed at emancipation. So ontologically, the paradigm assumes that reality is shaped by social, political, and cultural values, which gel over time to form the social structures in society. The knowledge is obtained through a dynamic interaction with the world, and axiologically, the aim is not just to, describe reality or to acquire knowledge, but to promote social change. And methodologically, which is the most important part here, knowledge from different and contradictory methods of inquiry is possible, and dialogue is needed to examine the differences and similarities among the information acquired from the different sources. So essentially, critical theory does allow the use of mixed methods research. And here is my research design. It is a multi-phase mixed methods research design with 3 phases. In the first phase, qualitative information is collected and analyzed and then used to build the instrument, as I would have mentioned before. And this happens in phase 2. And this instrument is administered in phase 3 and collects both quantitative and qualitative information. An important part of the third phase, though, is the merging of the findings. There's misconceptions in terms of mixed methods research being just the collection of quantitative and qualitative data, but the merging part of it is very essential for a study to be called mixed methods. So this slide here brings the research design and the research questions together to clarify the relationship between both. So for the initial qualitative strand, this is where I'm finding out about the functionings of importance. I'm collecting this information via interviews with working age persons with disabilities, as well as managers of disability organizations. And I'm using the information to build an instrument. So I'm interested in understanding, how information from individual interviews can inform the measurement of well-being. So that's my second research question. I'm using the instrument to collect both quantitative and qualitative information. So there's both closed and open-ended questions. And the quantitative information is being used to answer the research question, to what extent is well-being achieved. And then the qualitative information is being used to answer the question, what factors hinder well-being? And as I mentioned before, merging is an important aspect of mixed methods research. So hence the last research questions. How do the findings from these 2 strands, when brought together, how do they jointly explain well-being? So I'm just going to talk a little bit about the sampling and instrument for the exploratory phase and the convergent phase. I'm starting with the exploratory phase. So a purposive sampling technique was used to identify persons with disabilities, working age persons with disabilities, to participate in this phase of the study. And as I mentioned before, interviews were conducted with working age persons with disabilities and managers of disability organizations. Altogether, there were 25 persons who participated in this phase of the research. And the instrument was a 1-item semi-structured interview guide. Essentially, the working age persons with disabilities and the managers of disability organizations were asked about the livelihood issues that working age persons with disabilities face. For the convergent phase, there was not a frame of persons with disabilities, so it was impossible to obtain a random representative sample of persons with disabilities. So a snowballing technique was used to obtain the participants for this phase of the research. Altogether, there were 77 persons who participated, but the analysis that I'm going to present to you is based on 51 persons. And again, the instrument was the questionnaire that was developed. So that questionnaire that was developed, I'm just going to speak about it a little more. In the literature, there was a suggestion in terms of how someone can evaluate whether a functioning is achieved or not. And the suggestion was basically asking the question, do you have or do X, where X is the functioning that you may want to evaluate. And the suggestion in the literature was to attach a yes-no response options to the question. And there was a follow-up question as well, if no, why? And the suggestions in terms of response options were because I do not want X and because I am not able to obtain or do X. So essentially, when I obtain the list of functions, this would have been the general framing of each of the question. Obviously, if you have a certain number of functions, you'd have that same number of questions in the questionnaire. So each of those questions would have represented. The only difference is that this second option here, I would have eliminated it. And in the exploratory phase, persons, when they indicated that X was a livelihood issue, they would have also indicated the reasons why X was a livelihood issue. So essentially those pieces of information were used in terms of responses for the if, no, why. So this, as I mentioned before, was essentially the frame for the questionnaire. It was pilot tested as well as sent back to the interviewees in the exploratory phase for feedback. And based on the pilot results, there were a few changes. The first is the response options changed to always, often, sometimes, never, just to ensure that we're able to accurately gauge that persons are achieving a certain functioning. The follow-up question was changed to if, never, why, and then based on the feedback with the interviewees, they wanted a change in the first option, which was because I do not want X, and they wanted a change to because I prefer to not have X because they thought that was more culturally sensitive. And as I mentioned before, the options here were filled in with information from the notes, and of course there was a blank line just in case someone had another reason that was not already listed. So this is like the questionnaire, the frame of the questionnaire that was used. In terms of the analytical framework, I mentioned already that the categories were always, often, sometimes, never. A functioning was considered to be achieved only if the person always achieved the function. So if they sometimes or often achieved it, it was not considered as achieved. And there were two levels of analysis, the sample level and the individual level. At the sample level, the question that was asked is how many persons achieve functioning X? So let's say, for example, for the function of having proper healthcare, we had about 50% of the persons always achieving proper healthcare. Then what we do is use that 50% to compare to the values in the table above on the slide here, which shows the deprivation level and the corresponding percentages. So this 50% would be compared to the values in the percentage column, and 50% would fall within 33 and 66. So what can be said in terms of proper healthcare is that this was moderate deprivation. At the individual level, the question that was asked was how many functionings were always achieved. So if we all together have Y functionings, then it's possible that persons could have achieved 0, 1, 2, 3, up to Y functionings. So essentially the number of persons achieving the various number of functionings were computed, and then that number of functionings, it was divided into approximate thirds, just to correspond to the values in the percentage column here. So let's say, for example, between 0 and a third of Y, there were 27 persons who achieved, there were 27% of persons who achieved between 0 and a third of Y functionings. Then essentially that 0 and a third here would fall in the last row here. What can be said is that 27% actually were severely deprived. So this is essentially the analytical framework. Another thing that I want to highlight is that preferences were also taken into consideration. So this So the analysis at both the sample and the individual level was redone, taking into consideration the preferences. So instead of just persons who always achieved a functioning, if they never achieved it but indicated that they preferred to not achieve the functioning, it was counted into always being achieved. So there were changes in some of the numbers that were calculated, and when we get to the results section, I think it will be a little more clearer. But there are two levels of analysis, a sample and individual level. And there was the case where the person always achieved a functioning. And then there was the case of where the person always achieved a functioning and preferences were taken into consideration. So in terms of results, I am presenting by the research question. So what are the functionings of importance? There were 32 functionings that were identified from the individual interviews. And just as examples, clothing, food, shelter, transportation, skills, and skills range from financial skills to self-care skills to orientation and mobility skills, family life and self-esteem. Those were some of the functionings that were identified. In terms of how the findings from the interviews helped to inform well-being measurement, what I did was computed the Cronbach alpha value, and this value was 0.9 for the instrument, which indicated that the instrument reliably measured well-being for the sample. Another thing that was noted from the identification of functionings is that there were some functionings that emerged from the analysis that were not previously used in poverty assessment, such as transportation. And I think if they are included in poverty assessments, I think the results in terms of the amount of deprivations that persons with disabilities do experience would be changed, not for the better, unfortunately. In terms of the third research question, to what extent is well-being achieved? The findings indicated moderate to severe deprivations for the working age persons with disabilities in the sample. Just to share a little more in terms of the deprivations, so this bar chart is for the sample level analysis. And what can be seen is that 6 of the functionings were achieved at a low deprivation level, 12 at moderate deprivation, and 14 at severe deprivation. So persons were deprived severely in 14 functionings. And when we take preference into consideration, the numbers are very similar. So in terms of low deprivation, the number remained at 6. Moderate deprivation, this number changed to 14, and for severe, this changed to 12. So we see that most of the functionings were either severely or moderately deprived. In terms of the individual level of analysis, the blue bars here represent when the analysis was done for always achieving the functioning, and then the gray bars represent the results for when preference was taken into consideration. And what you can see here is that no one achieved 0 functionings, but then also no one achieved more than 28 functionings. And this was both the case of when preference was taken into consideration and when it was not. So essentially, about 33% achieved severe deprivations. Actually, they had severe deprivations because this is the lower end. They achieved between 0 to 10 functionings. About 49% achieved moderate deprivations, and then the remainders achieved had low deprivations. In terms of about 18% of them achieving between 22 to 28 of the functionings. When preferences were taken into consideration, the statistics didn't change much. So in terms of severe deprivation, the percentage stayed at 33. In terms of a moderate deprivation, the percentage dropped to 47, and the extra 2% went across to the persons who achieved low functionings. But all in all, most of the functionings, or most of the persons were moderately or severely deprived in terms of well-being achievement, right? 33 plus the 49. Another thing that I did was a cross-case analysis. I was interested in finding out the role of work in terms of functioning achievement. So what I did is looked at the number of persons who worked versus number of persons who did not work, and their achievements of the various functionings. And so the blue graph here, the blue bar represents the persons who engage in work. The orange bar represents the persons not engaged in work. And then there are persons who also enrolled in school. So this gray bar represented the persons who were not working but also not enrolled in school. And what you can see here is that more persons who were engaged in work achieved the various functionings as compared to persons who were not engaged in work. And this is for a number of functions. Again, the graph here is for just a few of them. So persons who were engaged in work, more of them achieve having proper shelter, having proper clothing, having social skills and financial skills, and as well as self-esteem. So this piece of results indicates the importance of work among working-age persons with disabilities for them to achieve the various functionings, which will translate into overall well-being achievement for them. In terms of the qualitative strand, the factors that hindered well-being, I'm presenting just a few of them here. In terms of diagnosis and disability-related healthcare services, the persons who never achieved these things indicated that those services were unavailable. In terms of transportation, persons indicated that it was too costly, it was sometimes inaccessible, and in cases where it was accessible, it was unreliable. In terms of work, persons indicated that there was a lack of workplace accommodations, both environmental and attitudinal barriers for them to gain access to work. And they also spoke about the lengthened stay within the education system. And then lastly, for other functionings such as skills, and I mentioned that there are a number of skills that was assessed here. Safety, which referred to public safety as well as sexual safety, family life, and self-esteem. The persons indicated that their disability was the reason that they never achieved any of these. For the last research question, how do the findings from the qualitative and the quantitative strand in the third phase jointly explain well-being? Again, I'm presenting only a few core themes, but what I want to share in terms of the presentation of the information in the slide is that the points in blue came from the quantitative strand, the points in orange came from the qualitative strand, and then the red is either something that is specific to the context or something that emerged from the literature. So I'm speaking about work first. As I know I didn't present these statistics before, but from the findings, 65% of the sample were work deprived. So this by itself is an indication that there are societal hindrances for working age persons with disabilities. Another thing that emerged from the quantitative strand is that more than half of the sample had no or primary school education. I just want to remind us that the persons who participated in this research are persons who are 19 years and older. So half of them had no or primary school education. From the qualitative strand, some of these persons were still enrolled in school. About 6% in secondary school and about 18% in special schools. Now in Trinidad and Tobago, persons between the ages of 12 and 18 are usually in secondary school. The completion of secondary school happens at 18 years of age. So the findings here is an indication that persons with disabilities are disadvantaged in terms of being 19 years and older and still enrolled in school. In terms of the persons enrolled in special education schools, there is information also acknowledged by the Ministry of Education here that there is a disparity in the curriculum for special education schools and regular education schools. So another disadvantage in terms of education of persons with disabilities. And then another finding emerging from the quantitative strand is that there are environmental and attitudinal workplace barriers. So all in all, what these findings indicate is that there is need to change the educational work systems in Trinidad. In terms of the disability grant, this was one of the things that persons identified as important to them. 70% of them received the disability grant. Now, the disability grant, the issuance of it is inconsistent with promoting equal rights of persons with disabilities, specifically their right to participation in work. But just going along with what is presented in the findings, 64% of them stated that the grant was their only option, which means that they didn't have the option to work. And as you remember from the cross-case analysis, work does play an important factor in terms of improved well-being or the achievement of functions among persons with disabilities. So there is a need to have work and education systems set up so that persons with disabilities can participate in them. Another thing that emerged from the qualitative strand is that persons with disabilities were unable to meet their needs through the disability grant. And the information in red is the 1800 TTD is the value of the disability grant at the time of this study. I think it has changed now. Versus what the minimum salary of a person who work 40 hours per week month would get, 2400 TTD. So this indicates that there is a lack of evaluation of the well-being of persons with disabilities, and this is further emphasized when we take into consideration the extra costs that persons with disabilities have to endure. There is an emerging literature on the extra cost of persons with disabilities, and from this study, extra costs were identified in terms of supportive devices, healthcare, and transportation. So while we might want to say, the disability grant should be increased, we know that public expenditure may not allow it. So overall, the changes that need to be made is within the education and the work system, again, for persons with disabilities to fully participate in society and to have the well-being that they deserve. And next, in terms of overall well-being, only 52% of the sample achieved the basic needs. That is, 52% of them always had food, always had clothing, always had shelter. There were no one who did not achieve, no one who never had food, or no one who never had shelter. But for the person who never had clothing, they indicated that they were constrained financially. And now the aim of sustainable development is the satisfaction of the needs of every person. So there is a need to ensure that, the basic needs of persons at least can be met. Persons also indicated that they were deprived of healthcare, specifically disability-related healthcare and therapy. So there is also a need to, ensure that basic healthcare is possible for persons with disabilities. Overall, the systems needs to change so that the rights of persons with disabilities are safeguarded. And while the government is a pivotal agent of that change, there is a need for multiple stakeholder engagement. And this here is my last slide. I'm going to talk about acceptance. There were about 45% of the sample who had smooth communication with personnel at public places. However, there were about 18% of them who never had such interactions, and they indicated that their disability was the reason for that deprivation. Now, that reason is very synonymous with the individual conception of disability, whereby the restrictions are seen as an innate issue and nothing related to the social structures. Persons with disabilities also never achieved many of these skills, financial, orientation and mobility skills, self-care skills, and they also attributed the cause to be the disability. Another thing that emerged in terms of the quantitative findings is the level of deprivation in terms of acceptance. And acceptance here specifically by the community and by family members outside of the household. It was a severe deprivation. So there is a lack of general acceptance in society. So the recommendations coming out of the findings here is there's a need to promote the social conceptualization of disability, which essentially translates into promoting inclusive schools and workplaces, and there's also a need for disability awareness. So overall, using a sense capability approach and mixed methods does provide great insight into the well-being of working age persons with disabilities using the individual interviews or qualitative information to identify the functionings does lead to the creation of a culturally sensitive and reliable instrument for measuring well-being. And then using the instrument to collect both qualitative and quantitative information to provide information not only on where the deprivations were occurring, but where the reasons for the deprivations, which provided greater insight into what sort of policy recommendations should be made. So that brings me to the end of my presentation. I do thank you for your attention, and I look forward to the comments and the questions. Thank you again.